Hi, everyone. My name is Nanda Zaanan, and I'm the founder and CEO of Nutrive Health. We're based in Sausalito. About 7 years ago, I moved from Europe to the Bay Area to work on the first machine learning products in the semiconductor industry. And I had no idea that about 5 years later, I would be applying all my engineering and data skills to avocado toast. Because my journey took quite a different turn when I was diagnosed with a chronic health condition. I was experiencing awful daily digestive symptoms, and besides that it was very painful, it also really disrupted my life. So I made an appointment with a gastroenterologist, and to my disbelief, he told me that there was nothing he could do. No cure, no pill. Yeah, basically I was on my own. So this was very disheartening news, as you can imagine. So I set out on a non-stop Google search. And that's when I stumbled upon this body of science, which is called medical nutrition therapy, or more popularly known as food as medicine. I went through kind of a journey with lots of trial and error of different foods, and I figured out what worked for me. And yeah, that was truly eye-opening and the start of reclaiming my health. Well, all this research truly opened my eyes to the staggering reality of chronic conditions in the United States. 60% of US adults have at least one chronic health condition, and 90% of US healthcare expenditures is attributed to chronic disease. And what's even more interesting is the role that nutrition plays. So when we think about healthcare, we often overlook one of the most fundamental aspects of our well-being, and that is what we put on our plates. But the research has shown time and time again that nutrition does play a significant role in chronic conditions. First of all, it can help prevent the onset of chronic conditions. Secondly, it can aid in its symptoms management. And thirdly, it can also really improve outcomes by itself or in combination with drug therapy. Well, these are just 3 study numbers of conditions, but there are many more where this is true. So you might wonder, if this is so helpful, why are we not embracing nutrition more in healthcare? Well, the answer is knowledge. So many people don't realize the profound effect that even small nutrition changes can have on their chronic condition. And secondly, they're maybe unsure how to make changes without losing the joy of eating or feeling they're on a restrictive diet. Well, to illustrate the first point, let's compare these 3 plates. They all look like avocado toast, and they are. But their nutritional profile is quite different. So how do you know you need to eat the left plate for your condition and not the right? Well, that's where Nutrive comes in. We're bridging the gap between science and everyday living. So think about the last meal you had, which was probably breakfast this morning. Now imagine this meal being specifically tailored to your condition. Well, that's personalized nutrition, and that's at the core of what we do with Nutrive. We're based on science, and together with your personal profile and your preferences, we really help you understand what to eat and what not. Well, every day we hear stories of individuals who feel the impact of nutrition on their lives. So Nutrive isn't just a platform with recipes and meal plans. We're truly a lifeline for people with chronic conditions who want to go beyond drug therapy. We're currently supporting several GI conditions and maternal nutrition. So traditional healthcare has undoubtedly made significant strides in improving patient outcomes and treating chronic disease. But it's time to reimagine our approach by recognizing and including the preventative and therapeutic potential of nutrition. Well, with Nutrive, we're ushering in this new era, and we invite each and every one of you to join us on this journey. Whether it is somebody you know who could benefit from Nutrive, or you're an employer who wants to offer Nutrive as a benefit to their employees, we'd love to talk to you. Together, we can change the face of chronic conditions. And one plate at a time, we're going to make that happen. Thank you so much.